You're listening to Becoming More Me, and I'm Teresa Lear Levine, an EFT master practitioner and hypnotherapist who loves helping ADHD entrepreneurs and professionals who have big goals to get out of their own way and remove those subconscious blocks, those nervous system barriers to really showing up as the person you want to be and the person you need to become in order to achieve those things that you most desire in your life and business. Today, I am super excited to be bringing on Dr. Jessica London. Jessica is a doctor of physical therapy, a pelvic floor therapist, a pre- and postnatal coach, and a mom to two under the age of 5. She's also the founder of Your Postpartum PT and Wellness, which is an online pelvic health rehab coaching company that serves the pregnant and postpartum community and helps women reduce leakage, pain with intimacy, prolapse, and other childbearing or birth-related injuries while returning to strength training from the comfort of their own home. This is such an important conversation. There's often so much stigma around what happens with our bodies, both during and after birthing children. And today we are going to bust through all of that and learn the value of rehabilitation and regaining strength, both during and after we birth our children. It all starts now. Hey, Jessica, I'm so glad you're here today.
Me too. Thank you so much for having me, Teresa.
Oh, it's my pleasure. So I always like to start by just getting to know who you are outside of your business and all the amazing ways that you're helping people. Tell us a little bit about where you live, who your favorite people to spend time with are, maybe some hobbies or your favorite thing to drink in the morning, just some personal stuff so we can get to know you.
Oh yeah, absolutely. So I reside in Arizona in the hot part of Arizona, not the cold part of Arizona, so in Phoenix area. And I have two little kiddos, ages 5 and 2.5. I've been with my partner for almost 13 years now. And yeah, we moved back to my hometown of Arizona. We previously lived in the Pacific Northwest, Oregon, Washington area for about 10 years and loved that. But we're really screaming towards the sunshine to come back since a lot of what we love to do together as a family is be outside and ride bikes and hike, and do all of that just in the sunshine.
Such a great place to do it in Arizona. It's beautiful there. What
Yeah.
inspired you to get into pelvic floor therapy and postpartum recovery, especially?
Yeah, absolutely. So honestly, I'm a doctor of physical therapy and I didn't start in pelvic health. I actually started in orthopedics and specialized in orthopedics once I graduated. Worked in an outpatient clinic and also a workers' comp-based clinic too. So really just, the weekend warrior injuries, back, ankle, knee,
Yeah.
random people getting injured and then coming in to see us for rehab. And then I also transitioned into workers' comp. So that were getting injured on the job and really needing to gain functional long-term strength to do the work that they needed to do. And it was really during that time I got pregnant. I had a very unexpected and unplanned cesarean birth after planning a home birth.
Oh.
Yeah, experience. It was very traumatic at the time, but now it's just been like such a blessing after I did all of the healing work around it. But yeah, I was labored for multiple days. We had a very safe transfer to the hospital, but ended up having a cesarean, and that's actually really where I realized that mothers have been forgotten in this healthcare space. And after I had my cesarean, I was really ready for someone to round the room, the PT to round the room, to give me out of bed requirements and exercises, and to, help support me to start ambulating again and giving me my first starter exercises since I just had major abdominal surgery,
Sure.
right? And no one
And
came. No one came. Yeah. And I was really shocked by that too, because obviously in my studies, I worked on the oncology floor, and mobilized people that after post, surgery, whether it was abdominal surgery due to, cancer being removed from a body, it was really important and imperative for us to get these patients out of bed, ambulating, making sure we can rebuild their strength and
yeah.
endurance. And the same principles were not applied to postpartum mothers, especially in orthopedics as well. So, when we serve people in the hospital in acute care in orthopedics, people have surgeries. We are there as PTs at the forefront of making sure that they know what they need to do to heal, to rebuild, and to get home safely as well. So, of course, my PT brain is rattled, and I have a two stories at home, and I'm thinking they're going to come in and ask all the questions. And yeah, no one ever came. So, that's actually what really made me pivot, really finding this like deeper burning mission for wanting to try to solve the gap, not only in healthcare, but in the rehab specific field as well.
Yeah, it's such an important space to be in. I'm so glad that you're in it. When is the ideal time for a pregnant woman to start focusing on her pelvic health? And like, what do you recommend during that time?
Yeah, it's never too early and it's never too late. So I like to share that too, especially if you have like listeners right now that are way beyond pregnancy and they're like, don't
Sure.
beat yourself up if you didn't start in pregnancy. You can always start. There's no better time like the present, right? But in an ideal circumstance, truly around second trimester is a great time to start, getting more acquainted to your growing body, to your growing abdomen, to really start reconnecting the pelvic floor and core in a growing body. And second trimester, moving into third trimester, is where we start to make a lot more modifications in our workouts or in our exercise regimen to continue to strength train, to maintain endurance in our core and our pelvic floor. And then in third trimester, that's actually around 32 weeks, we start pivoting to not as much strength training and maintaining strength and endurance. And we really start focusing more on release and lengthening and letting go and hip openers and pelvis openers as we are transitioning to towards the end of the third trimester. We
Okay.
kind of have to let go of a lot of the strengthening principles and also start moving more into preparing the body to birth, whether that's C-section or vaginal birth.
Gotcha. What do you think are some of the most common misconceptions about like pelvic health, either during pregnancy or postpartum, which is probably more of my listeners?
Yeah, absolutely. So I think in general, the misconception is that, leakage with coughing and sneezing and peeing your pants is normal and it just happens after you have a baby, or pelvic heaviness, pain, pelvic pain, pain with intimacy. If people have that in pregnancy, the time to start working on that is in pregnancy. It's not to wait until baby has been born and then work on it, because so much progress and so many changes can be made. And also it's
Yeah.
like laying the foundation of a house, right? So if we only wait until postpartum to start that process, you're really delaying your healing. So if you're currently experiencing that and you're pregnant, don't just suffer through pregnancy with it. Really get started and supported in pregnancy. And truly, if you are dealing with any of those things that I mentioned too, postpartum beyond like 6 to 12 weeks, this is around for you, and it's not just going to go away on its own. It typically doesn't unless there is some sort of guided intervention. That's where we'll see those statistics rising, that if you're leaking at 12 weeks postpartum and there's no action or intervention, we also have consistent 5 year postpartum symptoms as well, that you're still leaking, you're still dealing with those symptoms. So I think people think, oh, when I'm done breastfeeding or when I'm just maybe more time will pass and it will just go away on its own. It's very likely that that might not happen, and we really need to take more action in our healing.
Yeah. I know I went and did pelvic floor therapy a couple of years, maybe a year and a half or 2 years after having my last son. He'll be 8 next month. And that was super helpful. It was also a time when I was literally in the best shape of my life. So I was just turning 40 and, I six pack abs and lots of muscle. And I was like working out a lot and feeling really good. And it felt pretty easy to make those changes. And then as like perimenopause is set in and some unexpected weight gain and things like that, I've noticed certain symptoms like the leakage and things coming back. And I'm like, gosh, what do we need to do like throughout the rest of our life in order to like maintain the results or build on them?
Yeah, and you really bring up a great point there too. Like early postpartum, the hormone cycle with estrogen and progesterone shifting is very similar to perimenopause and menopause. So I
Oh,
always tell clients like the same hormonal shifts that happen in early postpartum that first year is the same hormonal shifts that are re-engaging and starting again at perimenopause. So it's like if we don't solve those concerns or address them and gain that empowerment education and exercises in postpartum, it will just come back in perimenopause with like a harder way of recovering from it. So for you, like amazing that you got that process started. You're already familiar, you're already a little bit more educated. Totally makes sense that around perimenopause, some of these symptoms can start to resurface because of the drop in estrogen, and
Right.
there's a bit more laxity in the pelvic floor, potential weight gain that might be happening around this, and this big shift that happens. So, really, you might need to see someone again around this time to get strategies and exercises and education more specific to this period of life.
Right.
But huge kudos to you because you started that process earlier. When you do and re-engage, it's like, I always say when you first start a job, it's very disjointed and you're like, where is everything? Where's the bathroom? Like, how do I find everything? But if you take a 2-week vacation and then come back to that job, you're already going to know where all of those things are. So laying that foundation, it will be so much quicker for you when you do
Yeah.
kind of engage in some of those educational exercises for you or different strategies. It'll just happen. So the healing will happen so much faster for you to reduce some of those symptoms that you're experiencing.
Yeah, because I definitely don't feel like, and thank you for the acknowledgement, I don't feel like the muscles engage in the same way that they did before. I'm doing still very similar, like normal exercise routines and things, whereas before it's like the engagement felt different than it
Mhm.
feels now. And I don't know if that's a perimenopause thing or there's more weight on the frame of my body thing or what it is. But
Yeah. And it
any
could be a little bit of
advice
both,
there?
right? It could be a little bit of both, but what we also find in this perimenopause stage is we need to do more loading, which is called progressive overload. So weight bearing. I
Mhm.
think it's a missed mark in perimenopause as well as like not loading the body enough through weights, right? So sometimes if body weight exercises are very lightweight exercises worked initially in postpartum and maybe in that earlier phase where things felt more easier to connect and all of those things, then it tells us to, as we are starting to age, we need to add in more weight training, more strength training to stimulate the same nerve fibers and muscle fibers to get that
Right.
engagement that is needed. So sometimes that's just the missing piece for people too, is we're trying to do the same exercises that we did 10 years ago or 5 years ago or whatever, but really we need to reassess the body in its current state and give the appropriate exercises and load tolerance as well that's needed to be able to find that reconnection. And you said it's challenging to reconnect, right? So this can also happen with that laxity that you may be feeling too, is with that drop in estrogen. We tend to not get as much support to the connective tissues, the collagen, all of that. And so things are naturally a bit more lax. So now we're trying to work with muscles that are a little bit more elongated and starting to re-engage those. It'll take a little bit more time, but loading the tissues heavier will also help with that.
Awesome. I love weight training. That's been a favorite of mine
Yeah.
across the board, both very early postpartum and still. I just got to figure out how to adjust it, I guess. So, being that a lot of my work is in emotional well-being and mental health and subconscious health, how do you see a relationship between emotional well-being and like physical recovery postpartum? Have you joined the Becoming More Me community over on School, one of the fastest growing learning platforms without distractions and ads? If no, I'd love to see you there. My community is full of amazing, busy minded entrepreneurs who are working on becoming who they feel called to be in this world, in life, in business, with their health, with their wealth, with their relationships, and doing it in a way that's fun and pleasurable. I have over $15,000 worth of actionable resources, things you can start using and implementing today, as well as all the information that you need if you're interested in small group coaching, one-on-one work, or any of the other services that I have to offer you, including the Becoming More Me with EFT program. Hop on over to school, skool.com/discovery. Type in my name, join the community, and I cannot wait to welcome you there.
Yeah, they can't be separated. So that's an amazing question too, because I think so often people think of it just as a physical ailment or something physically that's happening with them. But really, the research shows is people who deal with pelvic floor dysfunction, whether that is leakage, prolapse, pain with intimacy, pelvic pain, all of these different things, there is an increase in anxiety, depression, and social isolation.
Yeah.
So, if we are having pelvic floor dysfunction, we know there is a direct correlation to our emotional and mental well being not being in its prime either.
Yeah,
And so, if we can,
confidence too.
right? Confidence, self-esteem, self-confidence, and lack of movement too, that can also increase with all of those other things that are happening. We then so self-isolate and then we stop moving as much. And it's sort of like a snowball effect because where all of those things are happening, and then the lack of movement contributes to more pelvic floor dysfunction. And so it really is important to address the holistic nature of the physical ailment that you might be feeling, and knowing that even though it's sort of been quote unquote like normalized, or I think as women specifically and mothers, we just say, oh, it's not that bad. Oh, it's not that bad. I can handle it. And we just suppress, 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 and like try to not acknowledge that side of things without really fully sitting in it and recognizing like, wow, this actually really is impacting my ability to go out in public settings, and the desire to be around other people for fear of maybe leakage or heaviness while I'm out, or incontinence, right? It is impacting my ability to be intimate with my partner, which is impacting me emotionally, mentally. So I think as women and mothers, we have the ability to stuff, stuff, stuff. And so when we really take a step back, it's like, wow, it really is impacting my mental, emotional well-being as well.
Yeah, absolutely. I don't think they can be separated either. So, when you approach this and help people with their postpartum pelvic health, how how do you go about that? And is it all physical exercises and such, or is there also nutritional components of this? What are the different components to the way you approach this?
Yeah, with us specifically, we really believe in a holistic approach. And so you can't just do exercises because exercises alone may not solve a problem in its entirety, right? So the things that we consider when we're working with our clients one-on-one remotely is we are auditing nutrition, right? So if and or woman is not eating enough protein and doesn't have enough nutrients, that is our building blocks for muscle. And so we're really not able to build good strength if we're not
Mhm.
eating an adequate amount of food in general, or if we're not eating enough protein to be able to supplement that muscle fiber growth. So nutrition is an aspect that we audit. Sleep is also because sleep impacts our ability to heal. And this is one of those tricky ones, right? With those moms in those first year
Sure.
postpartum. Sleep is challenging. Sleep is hard to come by. And so we're really trying to figure out, okay, this is a hard season. Where can we prioritize sleep? Is that getting off our phone and trying to go to bed early? Is that asking for partner support so you can take a nap in the middle of the day? Is that napping when the kids are napping, even though it's so hard and we want to do the dishes and the laundry? Like,
Yeah.
really, where can we
Mm.
prioritize sleep as much as possible that first year, even though it is hard to come by, because it will directly impact healing timelines as well. Stress is a huge thing that we're also looking at as well, because
Yeah.
and I mean, you know best out of anyone, right? Like when we're in this like fight or flight, system, then our body can't be at rest to
Nope.
heal. And so it will only drive up the symptoms that we're feeling and continue to put us in these pain cycles that are hard to come out of. And then, of course, there's education, and awareness. So some of the research says that people can make progress just by education and awareness alone. It gives them peace of mind. It gives them a clear knowing. It gives them, oh, now I'm all of a sudden connected to my pelvic floor just because I know what my pelvic floor is, where it's located, how it functions. Just the education piece alone gives empowerment, a feeling of safety, of healing. And so we end up seeing neuromuscular changes and neurophysiological changes just by education and awareness, visualization practice in the body alone. And then, of course, exercises is like our fifth component to it is there does need to be specific exercises for specific people, because we really shouldn't be slapping the same set of exercises on everybody and expecting everyone to get the same result.
Are there any exercises that are pretty helpful across the board?
Yeah, I mean, I think that being able to know how to visualize and spatially, somatically connect to your pelvic floor and your deep core system is really helpful. We start this off with breath work. not just Kegels, right? So this is where people like are only doing Kegels. It's like, wait a second, that's just contracting the pelvic floor. And oftentimes people do these long endurance Kegel exercises, which can be helpful for a very small group of people. For another group of people or majority of people, it will actually aggravate that area and could
Hmm.
contribute to an increase in symptoms. So when I think of exercises all across the board, we all need to know how to spatially, somatically, visually connect to our pelvic floor and deep core system, and then also know how to relax and lengthen, as well as be able to contract as well.
Yeah, that's really helpful. And I'm thinking of something that we should probably have brought up very much at the beginning, and we'll just backtrack. But can you actually explain for listeners, and a good refresher for me, what is our pelvic floor exactly? Like, what makes it up? How far does it span down there? What's it holding up? Like, what's it doing?
Yes, yeah, like what the heck is the pelvic floor, right? So we all have a pelvic floor, whether you are a child or a woman or a male, we all have pelvic floors. I think that people don't even realize that basic knowing, right? The pelvic floor spans the entire bottom part of the pelvis, right? So just for for anyone listening, if you're like driving or you're thinking about this right now, if you find the pubic bone, which is that bone at the front part of your pelvis, just down underneath there starts the pelvic floor. This is where, your clitoris, your urethral, if you're a female, is there, and then it moves into the vaginal canal and then the anal canal, and
Hmm.
then all the way back towards the tailbone. So, that triangle bone at the bottom, the back of our pelvis. The pelvic floor spans that entire distance from the front of the pubic bone all the way back connected into the tailbone. But
Okay,
it
that's super
also
important to mention because I think a lot of people just think it's like vagina related.
Yes, no, not at all, right? And so it's really important to note, like, yeah, this is where bladder and bowel habits, come into play. Sexual intimacy, like your pelvic floor is integrated into all of these different areas, but also like spans left and right too. So, if you're sitting and you kind of rock side to side, there's those sit bones, those little bony landmarks at the bottom of the pelvis. The pelvic floor is between those bones as well. So it's sort of like a diamond shape or like a hammock at the bottom of the pelvis. And then inside that pelvic bowl is what we call it, or the hammock, is your bladder organ, your uterus, right, where baby grows and connected to the vaginal canal, and then your rectum. So we have these three pelvic organs that sit on top of and are connected into the pelvic floor as well. So when we think of pelvic floor function and dysfunction, we're really thinking about, incontinence, urine output, bowel output, anything that should not be leaving the body when you don't want it to. That is dysfunction, right? Any
Yeah.
intimacy related components can absolutely be related to this as well. Mobility issues, even connected to hip pain or tailbone pain. This is very connected and close to the pelvic floor as well. So oftentimes people will have tailbone pain or hip pain that they've been dealing with for a very long time, not realizing that it's actually the pelvic floor that's driving that. So it's very
Yeah.
interconnected into those regions of the pelvis, the hips, the glutes, the adductors, all of the muscles around the pelvis as well.
Yeah. And that would also be things like prolapse too, right?
Mhm. Yeah,
Those
so those three
areas.
pelvic organs are sitting on top of the pelvic floor. So if the
Hmm.
pelvic floor doesn't have enough support and it's a little too lax, this is where some of those organs can kind of fall into the canals, either the vaginal or the rectal canal. It can fall into those and put a little bit more pressure where people would experience things like pelvic heaviness or like almost like feeling like a tampon stuck. Like it just feels like a fullness down there. But the other thing that can drive prolapse is too much tension or tightness in the pelvic floor, which just kind of creates like a hypersensitivity to those pelvic organs that are so closely connected into the pelvic floor as well.
Yeah. So what are some of like the bigger risks if somebody doesn't take care of strengthening or rehabilitating their pelvic floor?
Yeah, so it will tend to just get worse. It doesn't typically go away on its own. So, when you're experiencing the symptoms, that is the time to get support, whether it's in pregnancy, early postpartum, because if not, your body will only weaken as we get older. Hormones will shift in perimenopause, and these symptoms will just sort of be exacerbated. So it's
Hmm.
sort of like if you don't take care of it in the earlier phases, even preconception. We have people that come to us that haven't even had a baby yet and are having pelvic floor related concerns too. So really, whenever the symptoms arise, that's the time to handle it. If not, over time, the risk factors are they just continue to get worse, more leakage, more heaviness. And then you're just looking at potentially more surgical options versus conservative options, which can be handled majority of the time conservatively.
Yeah. And then, it can be really motivating to work out or work towards, six pack abs or great biceps or whatever else, but people don't necessarily like see their pelvic floor. What are some of the cool benefits of having a really strong, conditioned, like in shape pelvic floor?
Yeah, it's like the silent pelvic health epidemic, right? Because people aren't walking around just telling others that they pee their pants, right?
Right.
So the benefits of a strong pelvic floor is that you're not peeing your pants, you're not having to use pads and changing out pads all the time. You can just live freely and hike and do all of the movement activities that you want to do, that your heart desires without being limited. So that's very freeing and
Yeah.
contributes to, greater impact on your emotional, mental well-being and your families generationally too, right? If we're able to be with them versus like always worrying about issues. Other things too that if you really are focusing more on your pelvic floor too is intimacy. I think there's a lot of non-conversation happening around this, like it's so taboo or TMI, but there are people that
Not
have
for the
like
show. Go for it.
right? Let's go for it, right? Because it's like orgasms, right? Like if we're
Mhm.
like if you're having pain with intimacy, like that's not cool. That shouldn't be something that you deal with. But on the complete reverse, there are women out there that have maybe never achieved an orgasm or don't even know how to get there, don't know how to communicate that. And truly that comes down to a lack of knowledge of what systems, what body parts, right? Like how
Right.
does this even happen? And so this can be a pelvic floor issue where pelvic floor is too tight or doesn't really know how to contract. So when women specifically have an orgasm, their pelvic floor rhythmically contracts.
Hmm.
And so if that aspect of their life has never been explored or educated on, they could be missing out on a whole part of their life just by having a lack of understanding or a lack of connection to this pelvic floor region as well.
Yeah, that's reason enough for me.
That check.
That's new motivation. That'll do it for me. But yeah, I know it can be a little difficult for some people to put in the time. Like, gosh, I got to go to the PT for an hour or whatever, this many times a week, and do this thing, and nobody even really gets to see, quote, air quotes, the result. But I think what you feel when things are like well rehabilitated and strong in the pelvic floor is worth it for sure. Hey, interrupting this episode super quick because I'll bet you didn't know that you can hop on a free, no strings 15-minute call with me and get answers and insights into those things that are challenging you the most in your life and business right now. And receive several insights from me that will really help you to start moving the needle in those areas where you desire transformation, be it your business, your personal life, your health, wealth, relationships, all the things. So go to gamechangingconversation.com, select a time, and we will meet and have a conversation about what's going on in your life and the outcomes that you would most like to create in the next several months. Can't wait to meet you and chat with you on a call. Now back to the episode.
Absolutely. And just think of it like our foundation, right? Like if we build a foundation on a house, you need that foundational slab. The pelvic floor really is the foundation for the trunk and the arms and the back and the core. And it has to be steady and strong and know how to move appropriately. So if you do also have other, athletic goals or movements that you want to do, hiking, like working on your pelvic floor and being in a healthy state with your pelvic floor will only help improve strength and endurance and other areas of your life too.
Yeah. When do men normally have major issues with their pelvic floors? Are there certain things that happen? Like women going through pregnancy can be a big one, but obviously it doesn't have to happen for them to have pelvic floor issues. Like what tends to bring them on in men?
Yeah, I don't specialize with men, so I'm going to preference with that. I've never specialized with men. It's always been a woman thing for me, but I do typically it's later in life. So it is
Okay.
later in life. Same thing, atrophy happens as well, or they're not able to be intimate because they're not, there's like some of the atrophy, which contributes also to men being aroused.
Okay.
So pelvic floor also has components into arousal. And so if they can't be aroused, then there's not a whole lot of stuff happening in that area. So this
Nope.
is what actually tends to drive men to pelvic floor therapy is the intimacy piece, but
Yeah.
also you can have leakage as well. So that there are other aspects to that, especially if they've had a really hard laborious job. So like chronic lifting, chronic coughing, like a lot of pressure being put down on the pelvic floor. These can
Okay.
also contribute to men and women, but we tend to see more men in those like hard laborious, like construction and all of those things. If their pelvic floor has just been through the ringer, then they can start to notice things pop up for them down the road as well.
Yeah, absolutely. Do you think that it was mainly your experience postpartum that led you to want to specialize here versus
Absolutely.
doing
Yeah.
some other area?
Yeah, absolutely. I mean, I even had a rotation in pelvic health when I was in school, and I was like, this is really cool. I can see how amazing this is, but not for me, right? And so I really went into orthopedics, but it was through my experience of feeling really lost and alone and confused, even as a physical therapist. Like, even I was a specialist in knowing how to rehab bodies, but we didn't even get taught in grad school and our doctorate programs how to rehab from a C-section. So I'm taking principles and ideas from my post-op knees and my post-op shoulders, and I'm taking the principles and concepts of how important desensitization is around the scar and scar mobilization. And I'm taking all of those principles, but there really was and is still not a C-section rehab protocol. So I kind of made it my mission to create one. And then from there, went on 2.5 years later to have a successful redeeming home birth and did have a VBAC at home for my second baby and then experienced a vaginal birth that I was like, wow, I now understand why I've been put in this line of work or felt called to do this line of work.
Yeah.
I can connect to both people's birth experiences, birth journeys, and, had my own set of pelvic floor related conditions that I dealt with after my VBAC that also gave me more of an understanding and educational aspect of how important early postpartum recovery is as well.
Yeah, that's awesome. So you've helped hundreds and hundreds of people to, restore their health in this area. About how long does it generally take for somebody to get things in tip-top shape with a program like yours?
Absolutely. So it's honestly so hit or miss depending on the person and how long they've been dealing with this. But traditionally, we say within 3 to 6 months, we see full resolution, which is pretty incredible if somebody's been dealing with this for years and years. I mean, we had a client come to us with years and years of prolapse and pelvic heaviness, and within 6 months, she was heaviness free. Same thing
Mm,
with leakage, like leakage preconception, exacerbated in pregnancy, because that's typically what will happen. And we worked with her in pregnancy. She became leak free in pregnancy. And then she obviously worked with us in postpartum too to keep the leakage away. So honestly, I would say in 3 months, like in 12 weeks, you can see pretty massive changes. And for some people, full resolution in 12 weeks. For other people, it can take that between 3 and 6, just depending on also additionally their personal goals and desires. So, leakage and prolapse and pain with intimacy on a day to day, about 12 to 16 weeks is pretty normal. If we're trying to get back up to higher impact, like running, hiking, jujitsu, some of these weight training, then that's where we really start to notice it takes about 4 to 6 months to really get them back to running without leakage, running without prolapse, kickboxing, or some of these higher level type activities.
yeah, it's still not very long in the scheme of things.
I mean, it
Time's
really
going to
is.
come and go one way or another. Might as well get the benefit at the end of it.
It's so true. And it goes by so fast too.
Yeah.
And you learn so much. You feel so empowered about your body, even for future pregnancies or future postpartums. You have such a great groundwork that is laid. Once you do it once, you can always come back and revisit it. And the symptoms typically, resolve much quicker the second time around if something
Yeah.
does come.
And I recognize that everybody's situation's a little bit different, but about how much of a commitment time-wise is it to do the things that somebody needs to do to strengthen and rehab?
Yeah, less than people actually think. We basically our method, our pelvic floor restore method says 3 times a week, less than 30 minutes. And this is doable, especially if we're working with moms. They don't have a whole lot of time and energy. This can be done 100% remotely at home. You don't have to go anywhere. You don't have to have any major equipment. Majority of the resolution can truly happen in that 12 to 16 early week time frame, with just 3 times a week, less than 30 minutes.
That's amazing. If people want to learn more about this and see more of what you're up to, where is the best place to find you?
Yeah, so the best place is just to find us on Instagram right now. It's at your postpartum PT. You can always check out my link in bio, but if you really are like motivated and want to learn more and want to chat with me one on one, then they can just DM me the word restore, restore. And then from there, we can have that one on one chat to talk more deeper about their specific, goals and circumstances that they're wanting to potentially work on.
Oh, that's awesome, Jessica. Thank you for offering that. And anything else that you want people to know about their pelvic floor health that we may have not covered as of yet?
Yeah, we covered a lot, which I love. I think that, I would just drop the shame if you can. There's so much stigma and shame and TMI and hush hush
Mm.
about this. And I'm starting to see that lift as more women and mothers are sharing their stories and their journeys to know that, hey, this is not so taboo anymore. But really, you are your own best advocate. You are your own best. You're going to care about yourself and your body more than anyone. So really advocate for yourself, really express your needs and your desires, and just take that next step. And healing's totally possible.
I love that. Well, thank you so much for sharing all of your wisdom and your experiences with this. So grateful for everything that you shared today. And for everybody who's listening, I know you have so many choices when it comes to the podcast you check out these days. So thank you so much for listening to Becoming More Me. And thanks for being here today, Jessica. Thanks for spending some of your precious time with me today. If you loved this episode, please leave a review or simply share it with someone else who would get great benefit from it too. If you share on social media, please tag me so I can personally connect and thank you. Until next time, keep taking bold and brave steps towards becoming more of who you want to be in this world. You are capable, you are worthy, and you are enough. And if your inner critic is still trying to argue with those facts, hit me up. We've got work to do.